Most people buy hearing aids expecting one thing, that they'll make their hearing normal again. And when that doesn't happen, many people end up disappointed with devices that may actually be working exactly the way they're supposed to. The problem usually isn't the hearing aid. It's the expectations people were given before they got them. Because hearing aids can do some remarkable things, but there are also things they simply cannot fix, no matter how advanced or expensive they are. If you understand the difference before you get them, it can completely change how successful they feel. So in this video, I'm going to show you what hearing aids can genuinely improve, what they cannot repair, and why understanding this is one of the biggest predictors of whether people love their hearing aids or regret buying them. Section 1. What hearing aids can improve? Let's start with the good news. When hearing aids are properly fit and programmed, they can dramatically improve access to sound. Many people with hearing loss don't realize how many everyday sounds they've slowly stopped hearing. Things like birds outside, footsteps in the hallway, turn signals in the car, even subtle parts of speech that help words sound complete. Hearing aids amplify those missing sounds so they become audible again, and that alone can make the world feel more connected. But one of the biggest benefits people notice is improved speech clarity. Many types of hearing loss affect the high-frequency sounds in speech, things like S, F, TH, T, and K. Those sounds might seem small, but they carry a lot of meaning in words. Without them, speech can start to sound muffled or incomplete. When hearing aids amplify those frequencies correctly, speech often becomes sharper and easier to follow, especially in quieter environments or one-to-one conversations. Another improvement people often notice is reduced listening effort. Before hearing aids, the brain is constantly working overtime trying to fill in missing pieces of speech. That mental strain can be exhausting. When hearing aids provide clearer access to sound, the brain doesn't have to work as hard to understand what people are saying, and many people notice they feel less mentally drained at the end of the day. So hearing aids can absolutely make a meaningful difference. But better hearing does not mean perfect hearing, and that's where expectations sometimes get off track. Section 2. What people expect. Most people imagine hearing aids working a lot like glasses. You put them on, and suddenly everything becomes perfectly clear. But hearing doesn't work the same way vision does. Glasses correct a problem in the eye itself. Hearing aids are working with a much more complex system: the ears, the auditory nerve, and the brain. And when hearing loss occurs, it often means that parts of that system have been damaged. Hearing aids can amplify sound, they can make speech more accessible, but they can't rebuild the delicate structures inside the inner ear that were lost. So instead of restoring hearing to perfect, their job is to improve the information the brain receives. That's a very different goal, and understanding that difference is one of the biggest keys to hearing aid success. Section 3. What hearing aids cannot fix. Now let's talk about the limitations. The first thing hearing aids cannot do is restore completely normal hearing. They can improve hearing dramatically, but they cannot give someone the ears of a 20-year-old again. On an audiogram, normal hearing usually falls between 0 and 20 decibels. With hearing aids, the goal is often to improve hearing into a functional listening range, which may be closer to 20 to 40 decibels depending on the hearing loss. That allows much better access to speech, but it is still not identical to natural hearing. Another common misconception is that hearing aids should remove all background noise. Unfortunately, no hearing device can completely erase noise in a busy environment like a restaurant, and there's an important reason for that. Many of the background sounds we dislike, things like rumbling, clattering, and crowd noise, occur in the low frequencies. For many people with hearing loss, those low frequencies are already normal, which means hearing aids can't simply remove them. Instead, hearing aids focus on improving the clarity of speech so your brain can better separate the voice you want to hear from the surrounding noise. It's not perfect, but it can make conversations much easier to follow. Another limitation is that hearing aids cannot instantly retrain the brain. If hearing loss has been present for years, the brain has often spent a long time receiving incomplete sound information. When hearing aids restore access to those sounds, the brain needs time to relearn how to process them. This adjustment period can take weeks or even months. That's why consistent use is so important. The more regularly the brain receives those sounds again, the better it becomes at interpreting them. And finally, hearing aids cannot bypass the brain's hearing pathways. We don't actually hear with our ears alone. Each ear sends sound information along complex pathways into the brain. If those pathways have weakened over time because hearing loss went untreated, hearing aids still have to work through that same system, which means improvement is possible, but perfection isn't always realistic. Section 4, the real goal of hearing aids. When people understand these limits, something interesting happens. Their satisfaction with hearing aids often increases dramatically. Because the goal of hearing aids isn't perfection, the real goal is easier communication, better awareness of your surroundings, less listening strain, and more connection to the people around you. When those things improve, quality of life often improves as well. And that's where hearing aids truly make their biggest difference. Section 5, who struggles most with hearing aids? The people who struggle the most with hearing aids are often the ones who are given unrealistic expectations. Sometimes they were told, "You'll hear just like normal again." And while that sounds encouraging, it can set people up for disappointment. Because when hearing improves but isn't perfect, they assume something must be wrong, when in reality their hearing aids may actually be performing very well. So if you're wearing hearing aids and thinking, "They're helping, but I thought they would do more," you're not alone. Sometimes the issue is expectations, sometimes the programming needs adjustment, and sometimes it's simply the listening environment. But understanding what hearing aids are designed to do is the first step toward getting the most benefit from them. If you found this helpful, make sure you like, subscribe, and follow the channel. I share clear, practical answers to the same hearing questions my patients ask every day, so you can make better decisions about your hearing and get the most from a technology designed to help you.